Sorry about that. I'll be going over some housekeeping items before we begin this afternoon's panel discussion. During our time together, we'll be taking questions from attendees. To ask a question, please use the toolbox at the bottom of your screen to submit your questions in Q&A. Attendees will be in listen-only mode to cut down on background noises, and there will be a short 7-question survey after the webinar, and we would really appreciate your feedback. We're excited to welcome an exceptional panel of speakers today, each bringing a wealth of expertise and unique perspectives to our discussion. Drew Westbrook is an attorney at Westbrook Health Law. He focuses his practice on counseling clients in the healthcare and digital health industries. Mark Pope is the Director of Customer Success at Pope Tech, an accessibility platform. He has been helping website owners and content creators simplify their web accessibility since 2018. Rachel Sossman is Director of Strategy at Full Media, a healthcare digital marketing agency. She focuses on ensuring that Full Media and its clients are executing the latest best practices, staying on top of changes in public policy, and have access to affordable tools. Today's moderator, Lauren Funk, the owner and lead consultant at TL Funk Consulting. He helps healthcare practices grow, build successful independent organizations. He is the former long-term chief operations officer of a large multi-specialty physicians group. Now I'll turn it over to the panelists to begin this afternoon's discussions.
Good afternoon, everyone. And Laura, thank you for those introductions. So to get us started, let's ask the big question. What is digital accessibility?
Yeah, I'm happy to jump in on this one, and thanks for having me on the panel. So digital accessibility, just simply put, is the ability for people to access the digital content, all people to have equal access, but especially those people with disabilities, right? And so I like to think about it like, what if I didn't have a screen, right? Could I still access the content using my assistive technology like a screen reader? What if I couldn't use a mouse? Could I still get around that website and perform everything that needs to be done? What if I had some visual impairments and need good contrast just to see things just directly, right? Is it coded in such a way that that contrast is just natively there? And so digital accessibility deals with, can I use normal, considered standard assistive technologies to be able to have equal access to the content in that digital environment, right? So whether it's a website or a web application, a mobile app, email, or any of the other forms of digital communication that we engage in, a document that's been loaded onto a website or shared. And it's just important to make sure that, everyone, regardless if they have a disability or not, has that equal access.
So why is it especially important in the healthcare context?
I can grab that one, and if Mark has additional thoughts to offer, please do, as our accessibility expert. And I feel like whenever we were preparing for this, Mark reminded me of the importance of pointing out our closed captioning feature on this Zoom. So just wanted to make sure that people knew that that was available on the bottom. And we'll make sure that the transcript is available too on the recording once it's out there. So from a healthcare context, digital accessibility is really important, and it's something that we're focusing on as an agency because not only do many Americans have disabilities, so 1 in 4 people will become disabled before they reach retirement in the United States. So when we think about who healthcare people serve, it's really important to make sure that we're serving people with disabilities well. So from providing quality care and improving healthcare outcomes, which is an important goal for every healthcare provider, that's really critical for many of the missions of the organizations that are out there. There's financial incentives, obviously, to serve all those patients too. So when we think about getting market share, retaining our patients, those are patients who we're going to serve better and retain better whenever we can serve them well with our digital communications, which is now kind of the front door for most healthcare organizations. And now we have new legal incentives. We're going to talk about this a lot today. So we'll consider those a little bit, but we have had legal incentives for a long time. I will say that to serve people with disabilities. We're just having a little bit clearer guidance that's coming out right now.
Yeah, Rachel, I
Right.
think one of the things you just said there was, the front door. And if you think about it, I mean, a literal front door of a building, we've wanted to make sure that that door is open and accessible to everyone so that we can provide healthcare. Now we're shifting and we're creating all these tools and we're trying to drive improved care, more efficiency in practices with the digital tools. And it's time that we start to make those accessible as well, just in the same way that the physical front door needs to be accessible.
And I did want to point out that, a lot of this is best practices anyway. Like accessibility is probably good for everyone. Just like sometimes when I'm, carrying some boxes or something like that, I hit that button to auto open that door and I'm glad that it's there. If things are coded right on a website, having the good form labels and color contrast and good heading structure and well-written links that don't just say click here and I don't know where it's going to go, right? This stuff's like good for everyone. If I go out into a brighter light, the better contrast there is natively, it just helps me. Now, it's good for me, but it's critical for people with disabilities. And that's where it's important to understand. The other thing to consider too is especially, I mean, everywhere, but especially in the healthcare, this is a privacy issue as well too. Because so much of our medical stuff is being transacted digitally now. If I have to go to someone else to read to me my medical records or know what's being communicated, that's a violation of my medical privacy rights. And so making sure that they can navigate around into, if you have a portal that you're sharing test results and things like that, and I can't access them without, even a family member, I may not want them to see those records. Right. And so making sure that, the standard technologies that are used by people with disabilities, standard adjustments just work for them is a privacy issue as much as these other legal things we bring up.
Right. I think that is definitely an important aspect of it. So Rachel, you mentioned some of the legal incentives, but let's let Drew talk to us a little bit about some of the history around the idea of digital accessibility.
Yeah, I mean, accessibility as a concept has been around for quite some time. The Rehabilitation Act of 1973, so that's just a few years ago, right? Um, it prohibits discrimination on the basis of disability in programs conducted by federal agencies, in programs receiving federal financial assistance and federal employment, and in employment practices of federal contractors. So we've kind of established, all right, well, that's been around for quite some time, and that's the language that we're really, I mean, it's not the actual language of the statute, but that's what we're working off of. We also have the ADA, which has been around, the Americans with Disabilities Act, which has been around for quite some time, and it, in part, prohibits discrimination on the basis of disability in employment, in state and local government, and public accommodations, and a few other items. So when those laws were first enacted, we didn't have many of the digital tools that we do today. The internet did not exist in the way that we see it today. Perhaps some of the, if anyone wants to get super technical, perhaps some of the groundwork was being laid at some of these times. But as the tools grew and the internet and computers, and then we moved into more sophisticated and smaller packages like mobile apps. We started to see as a country that we needed a little bit more protections in place. We need to be more specific about certain aspects. And there have been for some time now certain protections and laws related to accessibility for websites, for state and local governments, um, And then there have been quite a few lawsuits and arguments about whether the Americans with Disabilities Act, Title III, which covers public accommodations, applies to websites. But we didn't have a lot of clarity, especially in the Title III public accommodations realm. The circuit courts around the country have had a number of splits and disagreements about some say, well, all websites must be accessible because they are public accommodations. Many of the circuits say a website has to have what's called a nexus to a physical space in order to be a public accommodation. And so we've been in a bit of a gray area for many um, entities and organizations that aren't state or local governments. Um, and so now we have some new rules that have come under Section 504 of that Rehabilitation Act. And among other things, it sets some standards for websites and mobile apps and kiosks for any recipient of federal financial assistance. And it prohibits discrimination in the same way that the Rehabilitation Act and the Americans with Disability Act prohibits discrimination against people with disabilities in those federal financial assistance programs. And we get a little more specific now when it comes to what that covers and what those standards are.
So with this new ruling from the Department of Health and Human Services, kind of back up a little bit and give us some context about what exactly an HHS rule is and who it applies to.
Sure. So the rule here is it's a full-fledged federal regulation. It has the full force of law. It went through a period where a proposed rule was published and the public was able to comment on it. And then it went through the required processes, and HHS finalized the rule, and it has now been published and codified. So it is binding, enforceable regulation that applies to any organization or program that receives federal financial assistance.
Yeah, Drew's the lawyer here, so obviously correct me if I'm saying anything wrong. But essentially, what we're talking about would be a covered entity. And so that would be an organization that accepts Medicare, Medicaid payments, that is receiving insurance payments in general, submitting insurance claims. Is that correct? Is that a correct kind of overview of it?
The insurance, not necessarily. To get really nuanced, the covered entity under the HIPAA rules is not exactly the scope of I'm going to call it the Section 504 rule, but it is very broad. So federal financial assistance is everything from a grant to payments for services to leases, discounts, it's services in kind, it's property in kind. So really, and without trying to get super technical and specific, if there's anything given from the federal government of any kind, this is going to apply. If it comes from HHS.
So
There are other, rules if you might get it from the Department of Transportation or something like that.
One of the things I wanted to point out, Lauren, is that we're all here today specifically to talk about the digital communications part of this rule, but it's actually very broad, and it covers your actual operations, your diagnostic procedures. It covers things like childcare and mental health organizations. So one of the things that we're recommending that people do is make sure that you take this to your legal team and your operations, and you're talking about how you are doing business as well, in addition to what your marketing and your communications teams know, because this isn't just confined to that marketing communications function, but from the digital marketing and communications function, making sure that you're thinking about it as really widespread is important too, because what we're talking about is not just your website. You have to be thinking about email communications, PDFs, social media accounts that you manage, video, if you have a Vimeo or a YouTube account, if you're running advertising, those your digital health platforms, if you have an online scheduling tool, wait times tool, those types of things. All of those are things that you have to consider right now as a part of this.
Right. Well, that really leads into my next question, because I'm from a healthcare organization standpoint, with all of the different programs, initiatives like the EHR incentive program to the HIPAA privacy laws, all of those things, it can seem somewhat daunting to try to understand what an organization is going to have to do to comply. So how would you compare this initiative to those other kinds of programs in relation to the scope, budget? How much could this be costing, ongoing maintenance, those kinds of issues?
I can hop in here. I I'm a digital marketing expert. From an operational standpoint, it's challenging to know exactly how things might be implemented in, in your organization. But when it comes to your digital communications in particular, I think that the key right now is that we have a runway. So organizations that have 15 or more employees have until May 2026, and organizations with fewer than 15 employees have until May 2027. And one of the reasons why they decided to set those guidelines was to try to help organizations kind of defray the potential costs that they might have to invest into it. So gives a little bit of time to consider and budget in the meantime, if that makes sense. But more than anything, I think there may be some it depends on where you are, right? So you may need to remediate, and the larger the organization, the more that undertaking might look like. So kind of auditing where you are right now, deciding what your goals are and where you want to be. That's a really good first step to understand, what is this going to look like for you? Do I need partners to help me execute it? So that's something where I need to budget time and money behind that effort. Could I need a new website? That could be a question you might have to consider and budget for. But ultimately, a lot of this, beyond their remediation and the potential for website design, is going to be investing in training. And potentially, you may need to select some different vendors if you find that your vendors just don't understand these issues, if there are pieces that you're outsourcing. But ultimately, investing in helping your social media folks understand what's going on, the people who are sending out emails, anyone who's adding content to your website. And luckily, there's a lot of free training and free resources that are out there. It just has to be something where if you start now, you can make sure that you're planning for that time that you need to make those changes across the different areas where you're communicating. But Mark, did you have anything to add to that in particular, things that you've seen organizations do?
One of my recommendations often is exactly what you're saying, right? Getting clear about what your goals are, and then looking at the different outcomes that you want to accomplish, and then prioritizing them, right? Because and the training aspect you brought up is something I regularly push. Everyone should know digital accessibility for their role, right? I don't need to know everything maybe like a web developer needs to know, but if I'm a content writer, there's probably 5 to 6 things. If I know them about accessibility, then it's going to cover 80 to 90% of the content that I'm producing, right? And so just knowing things like, how to write a good link, And I joked about the click here, read more type of link before. So if I'm a person using a screen reader, right, and it's not just blind people, maybe I'm dyslexic, right, and using a screen reader to help me out. There's a lot of times we often miss some populations that are using assistive technology when we think about this. But one way you navigate is by, yeah, you could just tell the screen readers to just start reading the web page, but that's going to start reading all your heading stuff and menus or whatever, and that's very inefficient. So they don't do it that way. I don't look at a web page that way as well either, right? I might jump to heading levels, things that bold out, and that's what, or bolded things, right? Or I might jump to looking at images, or I might jump from link to link and seeing visually what's on that page. Well, the same thing with the screen reader, right? They're jumping from link to link to link. So knowing how different people utilize different technologies to access the website's important to know, what are we coding for, what's priority. And so things like, links, good color contrast, good heading structure, tables that are written in a way that the header and column rows, that the row and column headers are scoped out so that it knows it's a table and what's in a cell when I get there. Right, little things like that can make a big difference for accessibility. So, learning accessibility for your particular role is important, and having the training for the people for that. But going back to that prioritization thing I brought up, it's great to take those free tools and just start hitting every page and tackling it. But I tell people, that automated testing is great and doing that, but very quickly diving deep on your key user journeys, like what's the most important. And I'm thinking from a website perspective, because that's what I focus on, right? So when a person comes to a website, what are the key functions that they're going to do? Maybe going to the web page, logging in or creating an account, right? Signing up for something, or going and viewing a medical record. I think about those key 4 or 5 user journeys and map out what are the pages along the way. And then I want to go prioritize making those accessible first before going and fixing maybe a contrast error on a blog page that hasn't been visited, for, 6 months, right? So, thinking about what the goals are, what the priority is, what the gap is from today to where we want to be, and what resources are needed to get there, including training and funding, and then just putting them in your queue like other things, and go prioritizing them and knocking off. Okay, this is the biggest thing. Let's tackle that. Then move on to the next one. Accessibility really isn't a one and done thing. As you probably are picking up here, it's a new way of thinking about, well, let's make sure there's equal access. And I wouldn't even say new, right? I'll get to that when we get to the WCAG requirements. People have been thinking about this for a while, but maybe you haven't been, right? So it's new to you. But, prioritizing things and thinking about how you want to approach it and tackle it is just part of everything we do, right?
Okay, Mark, you brought it up. The WCAG, what is that, and why is the HHS following that in its rule?
Yeah, so the WCAG is the, my brain just froze on me, but the Web Content Accessibility Guidelines. There we go. I got it. Perfect. So it's actually written by a group called the Web Accessibility Initiative, which is actually a group in the W3C. So that's a lot of groups within groups, I know, but the W3C are the people who write the guidelines for the internet, right? They write the coding standards for how, developers should code websites so they work. They write the browser standards of how browsers should work. They're the people who write the guidelines so the internet just works the way we all have come to expect it to work. And so, they've been, around since pretty much the internet came around. And early on, they did start thinking about digital accessibility. That Web Accessibility Initiative group that I brought up, they had formed it by 1997, I believe is the date that group was formed. By 1999, they had released the first Web Content Accessibility Guidelines, or the WCAG 1.0. And so early on, they saw the internet and the great power that it could be for, equalizing a lot of access for people with disabilities and who might use assistive technologies like screen readers and maybe can't use a mouse to get around a website and had to focus only on keyboard strokes. And they developed some guidelines for that. The most recent version is 2.2. The health requirements are under 2.1 AA, which came out in 2018, I believe. So these guidelines are just a set of principles that help us understand how to create and code websites so they work for just everyone, right? With a reasonable level of accessibility for those using assistive technologies. I tell people too, there's a lot of this testing. If you get into the guidelines, you might get overwhelmed by them themselves. There's some easy checklists to understand. My friends at WebAIM have a WCAG checklist that might break it down a little bit easier, but they break it down into different levels, right? So there's level A, level AA, level AAA in the WCAG. Most of the legal requirements are at the AA level. Some of the AAA stuff is great to strive for. Some of it may not even be technically possible, which is why it's probably not required in some of the legal requirements. But the AA stuff is very achievable. And so you just go through the process of doing it. Now, accessibility testing to achieve these requires, for most organizations, both automated and manual testing to do it. And what I mean by that, automated testing is using like one of the free tools. I'm a little bit partial to Wave from WebAIM, partially because that's the engine I use in my platform, but there's a reason why we chose it. It's great for beginners, but is very powerful for professionals even. And it's one of the most used and trusted engines out there, but it's free. If you go to wave.webaim.org, you can go put in a web URL and it'll scan it, right? And a lot of people focus on, what are the red errors, right? That's fully detectable in an automated way. There's yellow alerts, that's suspicious, but requires human judgment. And then there's other categories that help with the manual testing. But in addition to that, to achieve the AA standards, a lot of the success criteria there require some level of human review. And so we automate test every page, but then we think about those key user journeys and use both automated and manual testing. And manual testing means I test with the same technologies users with disabilities use, right? And so I need to learn, or someone needs to learn, how to open up a screen reader and go, try to fill out that form using the keyboard and listening to a screen reader. What happens? And a lot of times people get overwhelmed because they're not used to it. Right. But if I lost my sight, I'd very quickly learn how to use that technology at a much more proficient level. And so it's just really a mindset, right? And so when I work with people, I'm like, just kind of start by turning it on and turning it off, right? Then turn it on and jump from link to link and listen to it. And then turn it on and go listen to how it sounds when it hits the images, and be like, if I couldn't see that image and that were read to me, does that seem reasonable that it's conveying the same content as why that image, the purpose it was serving when it was put there? So the WCAG guidelines map onto requirements like that cover the breadth of what's on the website, from images and links and contrast to video content to everything else, of like, this is what it would be reasonable if it passed. And it requires both automated and manual testing to determine that.
Lauren, let me jump in really quick, because we've had a couple of questions that are, I think, related to what is 100% compliance, if that makes sense. So, like, how do you know if you're doing enough, or how do you manage it when you have a lot to manage? And I thought that was kind of a worthwhile question to stop and talk a little bit about, because I think this, like many areas, is one where there's gray area. And I think that it's a thing where having your processes in place, having your goals and working toward them, and documenting on an ongoing basis exactly what you're doing. The manual audit process, if you're doing automated scanning and you're going back and making those changes as you go. I think that that's going to be really important to continue to document and show the work that you're doing, given that this is an area where even when you're following the WCAG standards, the 2.1 AA standards, there's still some subjectivity there in whether that's fully accessible to a person or not. But I wanted to pause on that really quickly and see, Mark, I know you help people kind of set goals and work toward those goals. And then Drew, I know you have a lot of experience in the realm of risk management around those types of things. So I thought we could comment on that quickly.
I guess I'll let you go for a second, Drew, because I was just
Okay.
checking. So
Okay. I mean, one thing to remember. All right, so we have standards. Okay, you need to meet these standards. That is what the rule says. The 2.1 level AA, you need to comply with. But also the reason we have those standards is to prevent discrimination against those with disabilities. So if efforts are being made to meet those standards, and there is a standard that requires a little bit of human interaction or judgment, and a company has put in the effort, especially if you've done so with someone who might have a disability that you're trying to make sure that they can access your site, you've worked through that process. Well, some sort of technical non-compliance, you'll be able to show actually here we're complying with these standards because we did these processes, and a screen reader can read this, or we have alt text that is sufficiently descriptive, or some there's a wide range here. Also, we can talk about enforcement later as a bit of a separate conversation, but think about enforcement of things, since we're in the Office of Civil Rights in HHS, enforcement of the HIPAA security rule. Well, if you're not complying with that, and then you're faced with an investigation, there's a process. It's not just well, you didn't meet this tiny little piece of it, and so now we're going to fine you millions of dollars. There's an investigation process, response. There may be remedial action required, but if you're talking about, well, we were 99.9% compliant with 2.1 level AA, your remedial action is probably not going to be a big lift at that point. So, it is important to think about, how do we fully comply? Absolutely. But there's also the thought process should be, we need to try to comply, and we'll get there, because it's a long-term process. This isn't set it up once and you're done. This is, as you continuously, there's social media, you're constantly going to be posting. You need to make sure that people know what they're doing as they post, because your website might be compliant, but if you make a bunch of social media posts in the future, those might not be compliant.
And to me, it comes back to that prioritization type of stuff that I was chatting about earlier, right? There's a whole list of things you want to do, map it all out. That's great. But don't wait to start working on stuff that that are impactful while you're mapping stuff out, right? That's what I would say. My first advice is just get going, like get some of those free tools and start running on your key user journeys and working on that, right? But map out what you need to do and have a running list like everything else that you do that has complexity like this, and keep adding things to it and adjusting the priorities as you need to. But, focusing again, I'm thinking websites, right? On those key user journeys. To me, I'd get as quickly to that human testing as possible on those and do that, because if someone came to me and said, your website's not accessible because of this or this, I would be like, yeah, show me where. And then underscores the importance of a web accessibility statement, right? You're going to put that on your website at the bottom. You're going to link to it. You're going to talk about what you're doing, what your goals are. But more importantly, having a way for people to reach out and communicate to you when they're having issues, so that both you're aware of what the issue is, but also how you can help them out and accomplish what were they trying to do, and can we help them get that outcome right now while we prioritize and remediate the barriers that were there for them. So having that statement on there early on is great, and then thinking about what are the priorities that we need to do, and breaking it down. A lot of people newer to web accessibility, I tell them go tackle a bunch of easy errors so that you start understanding accessibility, you start leveling up, and you start making an impact. But then very quickly start getting someone in your organization knowing how to use some of these assistive technologies. Content scaling is easy, like zoom to 400%, control plus 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 till you get to 400%. Does the header, is it a sticky header that now covers all the content or not? Or did that disappear so I now can view the screen? If I scroll everywhere, does it look good at 400%? Again, just being some practical first action steps, taking those is what I recommend, but then also start mapping out those key user journeys, and then going and tackling those and getting them there, having that accessibility statement, and then thinking about what are the different roles and what training do they need, are all practical things. If you're doing that and you're moving forward, that's great. A lot of times when people start talking to me about, oh, how do I be 100% compliant or whatever, sometimes I feel like they're using that, oh, I don't think I can get there, or anyone can, and they're using it as an excuse to not get started. But I say we shift it back and go like, what's the reason we're doing this for, like Drew was saying, right? And why does this matter? And we want to have equal access for everyone to be able to access this content, and let's consider how we can make this available to them.
I recognize that we're primarily focused on our, I'm going to say our own web content, meaning each organization. But one thing to remember is that the rule also covers contractors. So if my organization subscribes to a vendor that provides, let's say an app that we use for collecting forms prior to visit, well, that vendor needs to be, even if that vendor is not directly federally funded, if my company that's hiring them and they're providing that service on my behalf, that vendor's got to start complying with these requirements as well. And so prioritization, totally agree, Mark. Some of that might be, you've got to look at your vendors, your vendor contracting process, and going back, and maybe you can make somebody else do some of this work. And it depends on what your contract says, but sometimes you'll see things like, if the law changes, then we've got our right to cancel if you can't comply. Well, this might be one of those instances where you say, I have to comply with this law, and this vendor now needs to comply with this law.
What do y'all think is the rate of, or how many people know about this? And especially I was thinking when you were talking about the vendors, if they're kind of detached, or not detached, but they're one step away, how many of them really know about the implications to their services?
I haven't seen much about it at all. Jerry, I don't know if many people have been asking you, or Mark, if many healthcare organizations have been reaching out.
I would say there's a lot of people who know about the web content accessibility guidelines and are curious about whether they must comply. And but I don't know if there's a specific knowledge about this requirement and how it applies. I mean, I get questions all the time about accessibility for digital health tools. But it's usually not in the context of this particular regulation.
It just comes from an organizational desire to do it correctly.
Yeah, and in the past it's come from, does the ADA apply to us? And then often you'll see with some of the large healthcare institutions, they have some of this baked into their contracting process, and they'll require it. And so then it comes about that way, but not all of them.
so the ADA has been a law. So, like Drew noted, this is something that's not new. So any business really has a certain responsibility to be accessible, but have the guidelines been specific? No. So it's kind of come down to the judgment of courts if something goes to them. So many organizations care about it because they already had a legal responsibility to care about it, and they may have cared about it from a mission standpoint or a financial standpoint as well. So it's definitely something that people have built in before, but this specific new standard, I haven't heard a lot of folks talking about it yet, or seen. I know from our standpoint, we've been educating our clients about it.
Yeah, so maybe this time will help in getting the word out, because in one way I'm thinking from a leadership standpoint, May 2026 is a long way away, but I think it's important that we think about how long it's going to take. Mark, I was going to ask you again about the tools that are available. In my mind, I was thinking of it as a way to kind of set a benchmark. Okay, this is where we're starting, so it helps us know where to go. So, what's a good way to get access to those tools?
Yeah, the cheapest, easiest way to get started is just like with the fully automated tools, right? That hands down. Like I can test every page on my website automatically with automated testing, and just I don't, even if you have a 5,000 page website, it might take an hour or two to run that scan across it. Again, it's not going to detect all issues, but it gives you breadth of coverage and a good starting place. And so, if you want to do one page at a time and don't have budget, like go to wave.webaim.org, go check it out. Go look up Axe by Deque, right? That's another great free tool that's out there that you can download and install. You can even use Lighthouse, right? That's built into the developers tools to check things. I always tell people though, sometimes people get confused by Lighthouse because it'll be like, hey, you're got a perfect 10 or whatever, I must be fully accessible. But remember, this is just automated. If you read their documentation, they're like, you got a 10 on the automated stuff. Manual testing still, an important thing to consider. Right. And I wouldn't say that, like I paraphrase their stuff, but I would have been more forceful and being like, no, manual testing is absolutely essential to do to determine this. So, getting started with the automated is just low friction. There's things to start with the manual testing to get going easier. WebAIM has a hybrid between automated and manual testing called an AIM score, that you do a gut check by answering 10 things from manual testing to look at it on those pages. And again, the manual testing, think about your key user journeys, important pages, and go start testing them. Even like I mentioned before, just doing some basic content scaling, zoom to 400%, see what happens, right? Just start tabbing around the screen. Can I get everywhere, or do I get stuck? There's a keyboard cheat sheet of how to start keyboard navigating that's it shows you what to do. Hey, I start tabbing. If I hit a radio button, space bar should check or uncheck it, right? Or select it, I guess, not checkbox. It's a radio button, but you know what I mean? So there's some easy things, but some great free tools to get started with. But then I'd say don't, take some action, start working on it. Before you publish new content, have that free Wave browser extension and hit it and look at it and make sure you're not introducing any new errors, right? That's going to be critical as part of that journey. If, you don't want to keep adding fuel to the fire, so to speak. So, but Wave is a great one. Axe is a great one. Lighthouse is built in. So, there's a lot of great tools to start with. I would say just pick one and start using it.
Great. Well, in the spirit of good cop, bad cop, so Drew, you get to be the bad cop. Tell us a little bit about what the implications are with non-compliance, and how are they going to know?
Well, all right. So, caveat all of this by I would say there is some uncertainty with respect to enforcement of this regulation. That's kind of true for all new rules in a change of administration. we have a little bit more evidence of this not being a top enforcement priority with the new administration. There's kind of a sister regulation under Section 508 of the Rehabilitation Act that applies to government websites. And it appears that information on that rule is I'm trying to think of the best way to say it, but it appears that that's not going to be an enforcement priority. So we can assume and imply that this 504 rule may not be an enforcement priority. So the ways that this might come up, how would anybody know, right? Well, for one, your users will know. If an individual with a disability needs to access your web content or your mobile apps, which recall this is not, while I appreciate that there might be a lot of marketing folks on this call, this is not limited to marketing activities, and it could be patient intake activities. We haven't really talked about kiosks. Not everybody uses kiosks, but there is a specific section in this rule that requires kiosks to be accessible. This is, you might use a digital tool inside your physical building that needs to be accessible. So your users will know. Those users, if they are subject to discrimination, can bring a private lawsuit. That's certainly a way to face some consequences for failing to comply with these standards and discriminating against an individual with a disability. Through some cross references in the rules, you can ultimately get down to if a company faces a lawsuit and loses for violation of this regulation, the person suing can get their attorney's fees recovered on top of damages. So that is a somewhat expensive proposition. Then they can also, an individual user can bring a complaint to the Office of Civil Rights, which should trigger an investigation. Or the Office of Civil Rights has the power to initiate an investigation without any reason or cause. They can audit. If you're found to be in violation through that route, whether that's a complaint or an OCR-initiated investigation, then OCR can require remedial action. What you'll often see is there'll be settlements reached during the investigation where you'll have a very long agreement with the government that says you will do these things, and it's a long list. There are enforcement actions that you can find on OCR's website that don't necessarily apply to this new rule and the web accessibility standards, but they still apply to discrimination on the basis of disability. And you'll see that there are significant damages involved paid out to individuals. I even saw that there was one institution that had to set up a multi-million-dollar fund to kind of pay out for various things in addition to direct damages to individuals. So there are certainly enforcement incentives to comply, whether that's having to spend money to take action to correct or to pay out money in damages. And then there's also the damage to a reputation if you're found to be discriminating against individuals on the basis of disability. There could be repercussions simply from a business standpoint.
So very serious and deserves a lot of attention and work.
Yes.
Well, Lauren, I'm going to jump in if that's okay, and I'm going to bubble up. There have been a lot of questions, so apologies that we probably won't get to all of them, But I will say that we have emails and we'll have your questions. And so we can follow up with folks individually if we didn't get to your question. And of course, you will have our contact information as well. So if you want to reach out, feel free to do that. But a couple of themes that I've seen bubble up a few times. One was on social media and how to meet WCAG 2.1 AA guidelines on social media. So I'll comment on this and then I'll let Mark talk about it because I feel like he probably has a lot smarter things to say. But uh, really, you're looking at the same set of standards that are going to be on social media that will be on your website. You're just going to apply them in slightly different ways, knowing that when you're posting on social media, it's kind of a smaller thing that you're controlling and changing. So you're uploading images, you're gonna want to look at color contrast. You're going to want to consider, is there text put in this image that a person wouldn't be able to read if they're visually impaired that I need to put below in the actual text of my post? Do I need to describe the image in detail below it so that someone, again, who's visually impaired can understand that? If you're uploading video content, you need to consider closed captioning, transcripting. Are those types of things available? Alt tags, that's something that is widely available in social media platforms, is the ability to add alt tags. So making sure that you're actually using those features that are available. So those are my kind of comments. I don't know, Mark, you feel like I've missed anything that you'd want to add?
You know, I probably don't spend enough time on a lot of these social medias to know what features and stuff they do have, but those are some of the common ones I'd be looking at, images, alt text on that, or having text equivalent in the body of the content can meet that requirement as well too. Writing good links again would be in there. And so, sometimes just thinking about that, if it gives you ability to write, Hope Tech, make that the link instead of https://pope.tach. Now that's a short one, but a screen reader would read possibly that whole link. And you can imagine some links we've seen are like really long, and trying to listen to that and know where it goes would just be impossible, right? So writing good links, having good color contrast, all text on images, and then your video content, making sure that it's captioned. Some people stop there, which is great, but I want you to think about is there information conveyed in there that, the descriptive audio from like a movie, like the eagle flies over the mountain, like doing that, like if I couldn't see what's going on. We train our video creators to be verbose and being like, instead of like, oh, open up the menu, it's like, in the upper right-hand corner here is the profile button. If I activate that, it drops down a menu. I select the settings option, right? Then I don't have to be using the descriptive audio because I already did that in the narration. Learning things like that are great. So just, the same principles apply, but a lot of things in social media, I think, are covered by what you said. Document accessibility is one we haven't talked about as much. I know people aren't posting that as much in there, but PDFs are probably the hardest thing to make accessible in the document front. So using other versions, PDFs aren't good for most people anyway, because we're accessing the internet on our mobile phone that has a hard time with a PDF anyway. So turning it into HTML or using some other format to do that's often, we always say, do I need the PDF is the first question you ask. And then second, having someone trained to do that is probably what you need, because anyway, but yeah, great.
Yeah. Mark. Oh, I'm sorry. Go ahead, Drew.
Well, I was just going to jump in a little bit and kind of make some distinguish some exceptions from slightly different versions that aren't exceptions. So social media posts, your posts need to comply. You don't have to worry about Facebook's compliance as a company. You also don't have to worry about your anybody that's not acting on your behalf or controlled by you posting on your Facebook page or something like that. Those are third parties who are acting as true third parties, not for you, but your social media posts do. And then, Mark, you mentioned PDFs, and there is an exception for pre-existing what they call conventional electronic documents, which includes PDFs, but not if you're actively using them.
Yep.
So if you're like, well, to apply for our program, you need to fill out this PDF. Well, now you've brought that into the realm of you do need to comply. Um, so I just wanted to kind of hit those two things about talking about there are exceptions that you might see, but be careful because they're not that broad.
Mark, did you have any tools that you might recommend to for auditing social media or even scheduling tools that are helpful in that regard?
It gets a little trickier. I mean, but anything that loads in a page, the way browser extension can often hit, it can hit many of those social medias, things like that. But really, a lot of social media stuff to me comes down to learning 5 things about accessibility. And when you post, just following those, right? Like writing the good content, good links, and things like that. So, that I've already covered. So a lot of them can be hit because they're just on a web page or something in the context where the web browser extension can hit it. But sometimes they are a little bit trickier. And if you can't hit it with other things, then you're just left with the manual testing tools and hitting it that way with your screen reader and keyboard navigating through it. So.
Awesome. I know we're coming up on time. Laura, cut us off anytime we need to be. One question that I thought we would answer because it came up a few times was on overlays. And just talking about that, it seems like there's a lot of folks who use some different tools like UserWay or Accessibility, which essentially are kind of overlays that are meant to adapt your website for people with different impairments. I'll just say from a personal standpoint with Full Media, our agency chose to go a different direction and instead use more of an automated scanning tool over recommending that our clients go with overlays. And the reason why we chose that route was because we had seen some negative feedback. So I know there's been some kind of independent organizations from folks who are disabled who say that overlays have not been particularly helpful to them and sometimes interfere with their assistive technologies. And we also know that I think it's Accessibility that's under a class action right now because I think it's in New York State for not meeting its promises. So that's the reason why we chose to go that route. And I don't know if that helps anyone to think through, but we're not necessarily for or against it. If we had a client who chose to go that route, that's kind of their prerogative, but that's where we would recommend our clients go is more with an automated testing tool.
And with an overlay on a website that automatically changes content and you don't have the power to do it, the only testing that's left for you is all manual testing. It negates the ability for automated testing to be as effective. I mean, it's not the only, it still has some value, but let's say you have an image with no alternative text, overlay, throw some alt text in. Is that alt text meet the requirement? The requirement isn't just that there's alternative text on the image, but that the text alternative serves an equivalent purpose. So now I know that there is an image without alt text. There's something in there, so automated testing totally ignores it now because there's alt text in there. I don't know if that image meets the guidelines or not. So I have to actually go look at the alt text to see if it's accurate. And, the automated stuff, AI is getting smarter and smarter, but it's on the stuff I've seen, not still smart enough. And it can additionally impose additional barriers for accessibility. So again, if you install an overlay on your website, do your homework on it to make sure that it's fully accessible itself too, because sometimes they're even not. And, you're responsible for third-party stuff you put on your website. Best practices is that the code should be natively accessible. And so that's what we promote.
And with that, we are at the hour. So I think if we could try to wrap up a little bit here. I'd like to thank you all for being here today and Full Media for sponsoring this afternoon's panel discussion. You'll be receiving a recording presentation within the next 24 hours. And remember, there's a short survey following the conclusion of this. Also, I wanted to remind you that Rachel and the rest of the folks will get back with you if your question was not answered. So just rest assured, we'll answer all the questions via email. Thank you so much to everyone, and hope everybody has a great afternoon.
Thank you, Laura. Thank you, everybody.
Thank you.
Thank you.
Thanks for having us.